Welcome to today's webinar. Thank you for joining our session on implementing AI-driven reputation management for practice growth in healthcare. Before we get started, I do want to let you know that we'll be answering questions at the end of today's presentation. Feel free to submit any questions you may have in the Q&A at any point in the presentation. Even if you can't make it until the end of today's presentation, you can go ahead and submit your questions and we'll make sure someone reaches out to you with an answer. All right, so let's go ahead and jump in. First, I'd like to take a quick moment to introduce myself. My name is Lauren Parr. I'm co-founder and product director here at ReplyWize, which is a healthcare reputation management platform that assists healthcare providers in improving their online reviews, patient acquisition, retention, engagement, and more. I'm also a contributing editor of the Forbes Business Communication Council. I want to take a quick look at what we will be covering today. We'll start by discussing why reputation matters more than ever in healthcare and why it's no longer just about star ratings. Then we'll dive into the changing behavior of healthcare consumers, how they search, what they expect, and how they make decisions. From there, we'll take a look at how AI is already being used in healthcare and how it's starting to transform patient experience and engagement. We'll then talk through how the challenges practices face when managing reputation slows them down and what gets missed. After that, we'll explore how AI solves those challenges and walk through an implementation strategy that's simple, scalable, and effective. We'll share some real-world results from practices already using AI-driven reputation management. And then finally, we will open it up to some Q&A so we can answer your questions directly. So let's start with one of the most overlooked growth drivers in healthcare today, which is your online reputation. And your reputation is no longer just a reflection of what patients say about you, it's becoming a deciding factor in whether or not they choose you in the first place. In fact, it's not an exaggeration to say that your online reputation is your practice's growth engine. Just look at the data on this slide. Nearly 73% of patients say they read reviews before choosing a provider. That's 3 out of every 4 prospective patients making decisions based on what others say online. Over half of those patients require at least a 4-star rating before they'll even consider booking an appointment with you. And almost half will also actively avoid a provider rated below 4.0. These numbers are just too big to ignore, and they'll only be growing bigger as the digital first decision making becomes more of the norm. So the question isn't whether reviews matter, it's whether your practice is managing them intentionally or just letting them happen. Let's dive into how consumer behavior is driving this shift even further. We've seen how critical online reputation is, but now let's zoom out and look at the bigger picture, the role of artificial intelligence in modern healthcare. Artificial intelligence is no longer a futuristic concept. It's here, it's already transforming how healthcare systems operate across diagnostics, communication, triage, and more recently, reputation management. According to Deloitte, 75% of healthcare leaders are either scaling or actively piloting generative AI. Nearly half are already using it in clinical operations, from decision support tools to workflow optimization, and it's not just clinical applications. AI is now playing a powerful role in the patient experience, especially in how we listen, respond, and learn from feedback. Whether it's analyzing patient reviews, summarizing survey results, or automating responses, AI is now helping practices build better reputations and stronger relationships. Let's take a closer look at what today's healthcare consumer expects in this AI-powered landscape. So let's find out how patients are searching for care now and what that means for your practice. Healthcare search has evolved. It's no longer just about typing urgent care near me and clicking the top result. It's long tail, local, and highly personal. Patients are using voice and AI tools to ask questions like, can you recommend a good urgent care in Long Beach? And they're expecting curated, high trust responses powered by reviews, provider biographies, availability, and patient sentiment. What you're seeing here are two real examples. On the left, a traditional map-based result, and on the right, an AI-powered answer generated by a search assistant. Notice how it pulls in detailed provider info, reviews, hours. This is how Google's search generative experience and AI assists like ChatGPT and Perplexity are shaping the new front door to your practice. And reputation, it's right at the heart of these results. This is why your online presence and how patients describe you in their own words has never mattered more than now. Up next, we'll look at why traditional ways of managing reputations can't keep up with this shift. So let's talk about what's not working. Most healthcare practices are still relying on manual review monitoring. And while that might work at a small scale, it quickly becomes a bottleneck as your patient volume grows, or as you expand to a multi-location practice. Here's the reality. Manual responses are slow, inconsistent, and often reactive. There's no system to alert you when a negative review gets posted. Sometimes days go by before anyone even sees it. It's also nearly impossible to monitor every platform at once. Google, Healthgrades, Facebook, Vitals, RateMDs, and more. Without a centralized approach, important feedback from your patients can get lost and never be addressed. And even when reviews are noticed, engagement tends to be inconsistent. Some patients get a thoughtful response, others hear nothing back. That kind of inconsistency can erode trust and absolutely affects your reputation. To build a truly scalable, proactive reputation strategy, you need systems in place that can keep up. And that's where AI really helps to change the game. Let's take a closer look at how. So let's look at this side by side, what traditional reputation management looks like versus what's possible when we bring in AI. On the left, you'll see what practices are doing today versus manually checking platforms like Google and Yelp, writing responses by hand and trying to make sense of feedback without structure or consistency. There's no real categorization, no sentiment tracking, and often no alert when a damaging review goes live. Staff are stretched thin and reporting is time consuming and incomplete. But now look at the right. With an AI driven approach, specifically Repugen's method, everything can change. You get real time review monitoring across all platforms. Responses are generated by AI with the appropriate tone and can be auto posted or reviewed by your team. Sentiment is detected automatically. Reviews are tagged by issue, billing, staff, wait time, so you can pinpoint problems at scale. Negative reviews are no longer a surprise. You're notified right away, and your staff doesn't spend hours crafting responses or compiling reports. That's all handled. It's scalable across dozens or hundreds of locations, HIPAA safe, and most importantly, it directly boosts your SEO by improving engagement and response speed. This is the turning point where your reputation goes from a reactive burden to a proactive advantage. Next, let's look at what patients are really saying in those reviews and why most of it is more fixable than you think. So let's take a moment about what really drives those negative reviews, and this might surprise you. Nearly half of all complaints, 47%, have nothing to do with clinical quality. They're about how patients were treated by staff. It's tone of voice, attitude, communication breakdowns. Another 26% are about front desk interactions and long wait times. 18% stem from billing or administration issues. Only 9%, just 1 in 10, mention actual medical care as the problem. So the vast majority of negative feedback isn't about the medicine. It's about the experience. And that's good news because it means most of it is completely preventable. With the right systems in place, practices can identify these trends early, respond faster, and train teams to close the gaps. This is where the shift to AI-powered reputation management becomes truly valuable, not just to protect your online image, but to improve real patient satisfaction. Let's take a look at how we can turn that insight into action using AI. So, how do we move from simply reacting to bad reviews to actually preventing them? Well, it starts with a mindset shift. Reputation management isn't just a marketing function anymore, it's an operational strategy, and AI makes it possible to treat it that way. First, we track sentiment in real time, not just from public reviews, but also from NPS surveys and internal feedback. Then we map that feedback into specific sources, whether it's a provider, a front desk team, or even a billing process that's being mentioned. That gives us the insight we need to create a feedback loop. Teams see where things are slipping, and leadership can act before the issue spreads. AI helps scale this across dozens, even hundreds of locations. You're not relying on someone manually checking Google once or twice a week. You have eyes on everything all the time. And the real win is you can start preventing negative reviews before they happen. By catching low net promoter score scores or a frustrated feedback early, you get the chance to resolve the issue privately before it becomes public and before that patient feels the need to go and write that negative frustration on your online review sites. This is the heart of proactive reputation management. And in the next few slides, we'll show you how it actually works with artificial intelligence. So building a smart reputation workflow with AI, let's walk through what a modern AI-powered reputation workflow can look like when implemented effectively. This is a recommended framework. Repugen suggests for practices that want to move from a reactive manual system to a proactive scalable approach. It starts with feedback collection. Gathering both online reviews and post-visit NPS survey responses, these two sources give practices a well-rounded view of how patients feel across both public and private channels. Next is AI analysis. Tools like CommentWiz and sentiment engines can tag incoming feedback for tone, topic, urgency, whether it's frustration over wait time or praise for a doctor's bedside manner, it gets categorized automatically. Then comes prioritization. High-risk feedback like a one-star Google review or an NPS score below 7 should be flagged right away. This allows teams to act on the most urgent issues without delay. Step 4 is automated response. Tools such as ReplyWize can help draft HIPAA-compliant, human-like replies that can be reviewed or published before as needed. This saves staff hours while ensuring every patient gets acknowledged. Fifth, there's a feedback loop where insights from reviews and surveys are routed back to internal teams. This can support team training, operational improvements, and patient experience. And finally, performance tracking. With the right setup, practices can monitor shifts in sentiment, NPS trends, and review volumes across all platforms and locations, using dashboards that make the data easy to interpret. Again, this is a recommended structure, not a rigid system. Practices can adopt and customize these steps based on their own size, resources, and goals. In the next few slides, we'll look more closely at the specific tools that can support the kind of workflow, including CommentWiz, Sentiment, and ReplyWize, so you can see how they play a role. Now let's zoom in on one of our most foundational AI tools in this reputation workflow, CommentWiz. CommentWiz is designed to make sense of the volume and variety of feedback practices receive every day. Whether it's a Google review, a health grades comment, or an NPS survey, CommentWiz reads it and tags it automatically. It identifies key topics like billing, staff interactions, wait time, or provider care, so you're not left digging through dozens of comments to figure out what's going wrong. It also classifies the sentiment as positive, neutral, or negative, giving you an instant read on overall patient mood. The biggest benefit, well, it works across platforms. Google, HealthGrades, Facebook, your internal feedback systems, everything is analyzed through a single lens. And because it organizes reviews by issue, tone, department, it helps leadership quickly spot recurring friction points, whether that's tied to a team, a location, or a service. This is the tool that brings structure to your feedback, and structure is what makes action possible. Next up is ReplyWize, a tool that changes the game when it comes to responding to patient reviews. ReplyWize helps practices respond quickly and consistently to both positive and negative feedback, without losing that personal human tone that patients appreciate. It creates HIPAA-compliant replies that feel thoughtful, not templated. They're tailored to the tone of the original review. So a 5-star review gets a warm thank you, while a frustrated comment is met with care and professionalism. You can choose whether to auto-post replies or route them to your team for approval. We always recommend that you check them beforehand to ensure that it matches with your brand and tone of voice of your practice. But either way, it significantly speeds up turnaround time, and that's key, because patients feel heard when they get timely responses. It also helps maintain a consistent brand voice across all locations and team members. No more scattered responses from 5 different people, just a unified, polished tone that builds trust and protects your reputation. And finally, let's talk about the review summary engine, a newer but incredibly powerful addition to the AI toolkit. This solution reads through all of your patient reviews and feedback, then distills them into a short, actionable summary. It surfaces the most common themes, repeated praise, or recurring issues. For example, it might highlight that patients love the nurses or that billing confusion is mentioned 12 times this month. This gives you a high-level view of what's working and what's not, without needing to sift through hundreds or thousands of reviews yourself. It's perfect for monthly executive updates, board reporting, and even staff performance reviews. It helps teams see how they're doing through the eyes of patients with clear patterns and real-time context. It's not just data, it's insight packaged and ready to act on. Let's take a moment to look at what's possible when AI-driven reputational strategies are implemented effectively. This is Memorial Care Medical Group, a large multi-location healthcare system that partnered with Repugen to improve its patient engagement and review management. The results were staggering. Over time, they saw a 1,649% increase in the number of online patient reviews, a 23% lift in overall star rating, moving from a 3.9 to an impressive 4.8 stars. That's the power of consistency, automation, and proactive engagement. When you listen at scale and respond thoughtfully, it doesn't just improve reputation, it impacts growth, trust, and visibility across every digital channel. And it doesn't stop there. These gains now feed directly in how they show up across AI-driven search platforms. Here's what the kind of reputation growth looks like in action inside next-generation search tools like ChatGPT and Perplexity. When someone searches for an urgent care recommendation in Long Beach, Memorial Care shows up front and center. Not just in Google Maps, but also in AI-curated platforms where answers are selected based on reputation, relevance, and patient trust. These aren't paid placements. This is earned visibility, driven by review quality, engagement, and consistency across platforms. This is where reputation meets local search engine optimization, and it's increasing where new patients begin their journey. Let's walk through how you can build a similar foundation with a clear implementation plan. If you're wondering how to get started, here's a simple step-by-step roadmap we would recommend. First, centralize all your review sources: Google, Facebook, Healthgrades, etc., and your internal NPS surveys, like a 0 through 1 quick survey. This gives you a unified stream of feedback. Next, enable real-time review and sentiment tracking. Using a tool like CommentWiz, this ensures you're never blindsided by negative reviews again. Step 3, train your team. Make sure they know how to handle alerts, what thresholds to look for, and how to respond appropriately. From there, monitor your analytics dashboard weekly. Watch for sentiment shifts, sudden spikes in review volume, or repeated complaints by location. And finally, adjust based on what you learn. An AI tool doesn't just report, they guide action. Let the insights shape your operational decisions. You don't need to do everything at once, but this roadmap helps you take control one step at a time. Before you jump into a full-scale implementation, it's a good idea to first see where you stand today. And that's exactly what our tool ReplyTally is for. This is a free audit tool that gives you a simple visual snapshot of your reputation across top review sites. It's typically $5 per report, but for new prospective RepuGen interest, it's free for anyone who attended this webinar. It tells you how many sites are missing reviews, which listings are outdated, and where your ratings are hurting your visibility. You'll get a grade-based report that's easy to understand, even if you're managing multiple locations. As a bonus, when you run a ReplyTally report, you get 6 months of free access to RepuGen's AI-powered tracking and review responses service. It's called Review Pulse. So it's not just an audit, it's actually a first step in your transformation. Try it out for free and get the clarity you need before you start to scale. So, why do leading healthcare organizations trust RepuGen? Well, first, seamless integration. It connects directly with over 50 platforms: Google, Facebook, HealthGrades, RateMDs, Vitals, the list goes on and on. So, all of your feedback comes to one place. Second, it's an all-in-one AI dashboard. You get CommentWiz to decode patient feedback, ReplyWize to craft thoughtful responses, and Review Summary Engine to show you what matters most at a glance. Third, it's fast. You can live in under 48 hours. You can be live in under 48 hours. No complicated IT setup, no downtime, no hassle. And finally, it works. Whether you're a solo provider or a national group, RepuGen scales with you, and it's been proven to deliver results: increased reviews, higher star ratings, better retention, and happier patients. All right, so let's wrap up with a few key takeaways from today's session. Reputation is no longer just about reviews, it's about relationships, and AI makes those relationships easier to manage at scale. With the right tools, you can understand what patients are really saying, respond faster and more meaningfully, and track sentiment across every platform you care about. You can spot issues early on, before they go public, and use those insights to improve how you operate. Ultimately, your online reputation becomes your silent marketing engine. And with that, the engine becomes smarter, faster, and fully scalable. If you're ready to move from reactive to proactive, from manual to intelligent, this is where you start. All right, well, that is everything that I have to go over today. I want to open up the floor for any Q&A. If you do have any questions, you can feel free to go ahead and submit them into the QA section now, and we'll get through all of the questions. All right, it looks like we've got a few questions coming in. All right, the first one is, how does AI ensure responses to reviews are HIPAA compliant? Great question. So AI response tools like ReplyWize are actually built with healthcare privacy in mind. Specifically, ReplyWize, I know since it's our tool. They generate responses that are general, courteous, and non-specific to avoid any information of personal health info like PHI to stay HIPAA compliant. Additionally, practices can customize the response after ReplyWize creates that proposed reply. So this allows staff to review and approve the replies before they're actually published. So this way you maintain full control and ensure, that all of the responses are HIPAA compliant while still saving time. So we know that AI can be a really powerful and useful tool, but we always want to make sure that we've also got a human touch on these responses. So we always recommend to review the replies before actually posting them. Okay, and the next question, what's the difference between an NPS survey and a regular survey, and why do we need both? Yeah, great question. So NPS is Net Promoter Score. They're usually used for internal feedback, and they're really just a quick 0 through 10 survey where patients can rate how likely they are to recommend your practice or provider. They're typically private and allow you to spot dissatisfaction before it goes public. So if a patient rates, 0 through 6 or 7 on it, they can basically, you have the ability to address that patient's feedback and, not go and have them leave a review for you. But online reviews, on the other hand, are public and influence new patient decisions. So, um, yeah, having both gives you a 360 degree of patient sentiment. So having those online public reviews and an NPS survey, it's just the main difference is just the internal feedback versus your public feedback that other prospective patients can see. All right, another question, is AI capable of understanding the nuance in patient tone and emotion accurately? Yeah, so modern AI tools like CommentWiz are actually trained on large data sets of natural language models, enabling them to detect not just positive or negative sentiment, but specific tones like frustration, gratitude, or confusion. They can also tag feedback by topics like billing, front desk, bedside manner, which makes it easier to take targeted action. So while AI, of course, isn't perfect, it's genuinely accurate and helps get an even better continuous training with feedback as well. All right, another question. What if we have multiple locations? Can Repugen handle that scale without losing consistency? Yeah, so absolutely. Repugen is designed to scale seamlessly across multiple locations, states, nations. All feedback is basically centralized in one dashboard, and AI generated responses follow consistent tone and brand voice. So you can track sentiment trends by location, providers, assign issues to the right teams, and even customize alerts based on location specific thresholds. So whether you manage 3 or 300 sites, Repugen helps really make a consistent general overview. All right, I think we've got time for one more question, and we've got one more question. So, what's the difference between review summary engines and CommentWiz? Yeah, so great question. CommentWiz is our AI sentiment tool that scans all of your patient reviews and extracts key themes and sentiment, which really helps you identify the key drivers of patient satisfaction and dissatisfaction and allows you to filter throughout the different report that is generated to get a better understanding of and pinpoint specific drivers of satisfaction and dissatisfaction. While the review summary engine actually auto generates concise summaries of the sentiment that's left in your online reviews. So it's really just a more concise version of a summary, which is really perfect for team meetings or marketing content, for example. All right. Thank you, everyone, so much for joining us today. We hope this session really helped you see reputation management through a new lens, not just a reactive task with the proactive growth strategy it can be, powered by artificial intelligence. If you have questions we didn't get to during the session, feel free to reach out. We're happy to continue the conversation, share resources, or help you take the next step toward building a smarter reputation system. You can visit us at repugen.com to try RepuTally, access your free 6-month trial of Review Pulse, or schedule a walkthrough of the tools we discussed. I'd be happy to connect you with our team so you can learn more. And again, thank you for your time. Here's to a stronger reputation and healthier practices in the future. Thanks for joining today and hope you have a great day.